So how do you tell somebody, what's the best way for us to tell people who might be watching, I have to do this. I'm turning 40. I have no history, no family history. So my doctor's telling me, okay, you're going to be 40 years old. You have to get a baseline. Is it still considered a baseline? Is that correct terminology?
Yep.
Mammogram. Let's see what happens. And they are scared to death of what it might reveal or what. How do you alleviate that?
Well, that's exactly what you just said is the crux of the matter. Is
Scare,
that
fear.
It's the fear of cancer.
Right.
That really, when you boil it down, it's is my life going to be changed because I got the mammogram? So the mindset that you have to change is that the mammogram is going to cause me cancer because it's going to find it.
Yeah.
You see what I'm saying? So
right.
That's a human trait, is that what we don't find doesn't exist. And so I think one of the best things for women who really, and for men for that matter, who continually put off their routine medical care because they feel fine and because they don't want to deal with the consequences of having something serious, they need to have a buddy system and treat the test as if they're going out for a fun day. So I think we've had some good
parties.
Well,
it's called a mammogram. I mean, I've had friends
right.
who
you
they
all
would all
get
make
together,
their appointment at the same time,
and you go have some fun. You have a nice lunch afterwards, and you support each other.
Yes.
Rather than doing it, if you can't do it alone, then do it as a group.
So if you had to say to somebody, again, you're saying do it, and I'm saying it's for your own health. Do it because you need to do it, and it's so much better to know what about your body than not. So, doctor, if you could say one thing about how do you get a little bit beyond that fear? What do you think the difference is to someone who comes to advanced imaging and says, I'm here for my first mammogram and I'm scared to death?
Well, I mean, as I said before, you're here, you're scared, but you're here.
Right.
So, we can get you through the rest of it. There's a lot of fear, and rightly so, regarding breast cancer and other breast disease, not just breast cancer, but obviously breast cancer is the foremost. But as John said before, it's a screening test, meaning that everyone in the population, when they reach a certain age, needs that test. Mm-hmm. And the best way to preserve your long-term health is to just grit your teeth and get it done. And we'll make it as pleasant as possible. And also, oftentimes when we check your mammogram, we're checking it on site when you're having it done. In many cases, we do what we call additional views. We see something, and the breast, each woman's breast tissue, the fibroglandular pattern as we call it, the makeup of the tissue, which is basically glandular tissue mixed with fat. Mm-hmm. Every woman's is different. It's almost like a fingerprint. So sometimes we do a screening mammogram and we see something that looks a little different, or we see something that's a little asymmetric, and we get additional views. So that in itself provokes a lot of anxiety, because the mammographer will come back into the room and say, okay, we need to do an additional view of the left breast or the right breast, or both. And this is a very common thing. What the additional views allow us to do is focus on a certain area. It allows us to put more compression on a certain area to spread out the tissues better. And in most cases, when we do additional views, it's fine. We further investigate an area that we questioned. The additional view answers our question, and the mammogram is normal. So it's the benefit of having the doctor look at it on site is that sometimes if you go for a mammogram at another place, the mammogram is read later that day. They say, oh, the patient needs to come back for an additional view. You get a letter saying that something was abnormal. You have to come back. You make an appointment, and a week goes by, and you're wondering what could be wrong with my breast. When you come here, we take care of it in one shot.